All right, hi and hello again. I'm Greg Sommer, co-founder at Trak Fertility, talking live here from the American Society for Reproductive Medicine Conference in San Antonio, Texas. Really excited to be joined by Dr. Natan Bar-Chama, the director of Male Reproductive Medicine at Mount Sinai, New York, also urologist on staff at RMA of New York. Am I right on those things?
Yes, yes.
So
we are definitely at ASRM.
We are. So we're talking all things reproductive medicine and health, and just want to get your take on a few things. So we're of course focused on men's reproductive health early in the process. We speak to a lot of guys that are just getting started or trying to learn things. So, based on what's happening in the conference in the field, what do you think are some of the biggest challenges facing men today, and what do men need to know?
Well, I think that male fertility is not an assumption that one should take for granted. We're realizing that globally there is a declining sperm concentration. Many variables, environmental, lifestyle, health issues probably contribute to that. So I think for a couple that's trying to conceive, establish with confidence what the male fertility status is, and the sooner the better for the couple.
Yeah. Do you think men recognize the link between their reproductive health and their overall health or wellness or lifestyle?
No, of course not. Men have no regard for the implications of an unhealthy lifestyle. We don't go to the doctor on a regular basis. We are very different than women who are much more accustomed to being evaluated annually.
Right.
And so we pay the price. And one of those prices are that we just don't truly relate or associate excessive drinking, smoking, bad life choices, infections, and assume that there are consequences to that. But there are, and if a couple is trying to conceive, establish objectively what's going on.
Sure. So, is there an advantage? So you see a lot of men, you treat a lot of men. Is there an advantage to men improving their sperm quality, living a little bit better, getting healthier for their outcomes from a fertility perspective?
Absolutely. I mean, there's, sperm production is 3 months. And so every 3 months, you're making a whole new batch. There's nothing permanent about sperm production, or it's not a baseline that stays forever. And so optimization and improvement is possible and achievable if one focuses on it.
3 months, 90 days can make a big difference.
90 days is one full cycle, so 1 or 2 cycles of optimizing and focusing on your health can have a dramatic impact.
Great. Last question. Based on your experience or practice, is there one thing you wish guys knew before they came to see you?
It's a good question. I think, if you've made the decision to have a family, and obviously your wife is on board with that decision, be considerate and try to do the best you can to help achieve that goal sooner than later. If you don't do the best you can or focus on it, eventually the toll is impactful and potentially detrimental. And if you can be proactive and focused and help the situation, grasp and grab that opportunity.
Early proactive is always going to help.
With most things in life, and especially something like this.
Yeah. Dr. Bar-Chama, thanks so much.
My pleasure.
Always a pleasure. Thanks.
Thank you.